Can you hear it? The pulse of our region. It's starting to sound like progress. It's happening here and there, all around us. We're gaining momentum and catalyzing change. But it doesn't happen on its own. We need each other. Every person, every business, every organization, we all play a role. We're leading. We're collaborating. We're growing. Yeah, we've had some wins, but we still have work to do. We're leveraging our assets, investing in innovation, and creating opportunities for everyone here to share in this momentum. The pulse of our region is strong, it's steady, it's rhythmic. Can you hear it? Can you see it? Are you a part of it? Every beat represents the commitment, the drive, the determination that is uniquely Akron. Our progress is palpable, but we've only just begun. We're gaining traction and building something powerful, something together, something greater.
Good morning and welcome to today's Greater Akron Chamber Leadership Dialogue event. I'd like to begin by thanking our sponsor, Akron Beacon Journal Local IQ. You know, the lessons learned in a crisis are catalytic and can have an impact long after the crisis has subsided. The way we communicate, delegate, make decisions, and assess our work are all things that are heightened during a time of stress. Where there are cracks in any of these, a crisis can widen them. Where there's already strength, we become even stronger. The COVID-19 crisis has reshaped the world, business, industry, and people in unprecedented ways. This morning, we'll spend some time talking with leaders from some of our largest healthcare providers as they share their insights relative to the lessons they've learned over the last year in areas like leadership, communication, trust, and change management. We'll also draw an intentional parallel to these lessons and their application to business in general as we identify things we can all learn from their work in this crisis command environment. While crisis is at times something that's inevitable, there are great opportunities and lessons that arise from these experiences, provided that we're open to learning from them. To introduce our panelists this morning, we have leaders from each of our key healthcare institutions here today. They're going to introduce their colleagues. They're proud of the work of their teams and these individuals in what they've done, and are glad to introduce them to you all today. First, I'll turn it over to Dr. Brian Hart, President, Cleveland Clinic, Akron General. Then we'll hear from Lisa Aurelio, Chief Operating Officer at Akron's Children's Hospital, and Dr. Cliff Devaney, President and CEO of Summa Health. So over to you, Dr. Hart.
Thanks, Steve. I am honored to be able to introduce my friend and colleague, Steve Abdenauer, this morning. Steve is the Chief Operating Officer of Cleveland Clinic Akron General, a 531-bed tertiary care teaching hospital within the Cleveland Clinic Health System. As COO, Steve is responsible for the daily operations of Akron General's inpatient and outpatient network serving the 5-county area around the Akron market. His duties include facilities, construction, security, transportation, supply chain, radiology, lab, food services, environmental services, clinical engineering, rehabilitation, and wellness services. Prior to his current role, Steve served as COO of Cleveland Clinic Abu Dhabi, a 364-bed quaternary hospital located in the United Arab Emirates. Steve has over 30 years of operations leadership experience in healthcare. He is a native of the Akron area, having earned a Bachelor of Science in Mechanical Engineering from the University of Akron and an MBA from Walsh University. Steve also previously worked as a design and project engineer for the Department of the Navy in Norfolk, Virginia, and B.F. Goodrich Aerospace here in Akron. Steve played a key role in the COVID-19 response efforts for Cleveland Clinic Akron General and serves as a critical leader in this organization. I'm looking forward to the insights he will be providing today, and with that, I'll turn it over to you, Lisa, to introduce Christine Young.
Thank you, Dr. Hart. Good morning, everyone. On behalf of Akron Children's Hospital, I'm excited to have the opportunity to introduce Christine Young. Christine is the Chief of Hospital-Based Services and Chief Nursing Officer at Akron Children's Hospital. Christine is responsible for the operations of inpatient services, including inpatient and acute intensive care units, surgical services, emergency services, school health services, and the Akron Children's Home Care Division. Chris is the inaugural chairholder of the Grace Wakulchik Endowed Chair of Nursing. As the Chief Nursing Officer, she's responsible for the oversight of nursing practice, including the Center for Nursing Professional Practice, Nursing Research, and Advanced Practice. Christine obtained her Bachelor of Science in Nursing from Ursuline College and holds a Master of Science in Nursing and Business Administration and Healthcare Management from University of Phoenix. Chris is certified as a Nurse Executive Advanced through the American Nurse Credentialing Center. In 2017, she was the recipient of the March of Dimes Excellence in NICU Leadership Award. During the pandemic, Christine has served as the Operations Section Leader in the Akron Children's Hospital Incident Command Center. In this role, Christine is responsible for implementation of all tactical priorities of the hospital's pandemic response action plans, as well as assuring the safety and welfare of all personnel. Christine has been a leader in many phases of the pandemic operation response, including preparing the hospital and staff for an influx of COVID patients, developing and leading the PPE conservation program, preparing the Children's Hospital to care for adult overflow patients should the adult systems become overwhelmed, and for ensuring that reopening of the hospital's clinics and operations adhere to COVID-safe protocols. A crisis often calls for changes in processes, quick decision-making, and communication protocols, and puts a new test to leaders as they manage through unprecedented times. Christine's ability to lead amid the crisis is an example of what we can all learn from. Now I'd like to turn it over to Dr. Cliff Devaney to introduce Dr. Lydia Cook.
Thank you, Lisa. Like my colleagues, I'm excited to announce the Summa Health representative on today's panel. Dr. Lydia Cook joined Summa Health System as the president of Summa Health Medical Group in 2016 from HealthSpan Physicians, Inc., where she was a practicing pediatrician and associate medical director of sales, marketing, and government affairs beginning in 2013. Prior to joining the HealthSpan team, she had been with the Ohio Permanente Medical Group in Cleveland beginning in 1987 as a physician specializing in pediatrics and adolescent medicine. Her leadership and experience assists Summa Health Medical Group in continuing its model of high-quality, value-based care. Dr. Cook earned her Bachelor of Arts degree in Biology and African American Studies at Brandeis University in 1980. And her medical degree from State University of New York Upstate Medical Center in 1984. She completed her residency training at the Children's Hospital at the University of Medicine and Dentistry of New Jersey and at Rainbow's Babies and Children's Hospital in Cleveland. In addition, Dr. Cook completed an executive leadership training program at the University of North Carolina Keenan Flagler Business School in 2004. And received the Healthcare Excellence Certificate from Case Western Reserve University Weatherhead School of Management in 2013. Dr. Cook held numerous leadership positions at Ohio Permanente Medical Group over the years, including Associate Medical Director of Strategic Projects, Assistant Medical Director of Primary Care, Physician Director of Physician Scheduling, and Chief of Pediatrics and Adolescent Medicine. As I reflect on the events of the last year, I am certain that our success is due in large measure because of Dr. Cook's insights and leadership. We are very fortunate to have her at Summa Health. With that, I will turn it back over to you, Steve.
Thank you, Brian, Lisa, and Cliff. We're fortunate to have had your leadership and the leadership of your team over the difficulties of the last year. Lastly, I'd like to take a moment to introduce our moderator for this morning's discussion, Dr. John Langell. Dr. Langell is the president of the Northeast Ohio Medical University and has been in this role since 2019. Dr. Langell brings with him more than 20 years of experience in higher education and has served in senior leadership positions in academic healthcare, industry, nonprofit organizations, and the federal government. In his most recent position, Dr. Langell served as Vice Dean for the School of Medicine, as well as founder and executive director of the Center for Medical Innovation, both at the University of Utah. He was recruited to the University of Utah's Department of Surgery in 2006 as its director of acute care surgery, and not long afterward, also served as chief of general surgery at the George E. Wayland VA Medical Center. During that same period, Dr. Langell, a veteran of the U.S. Air Force, maintained his reservist status while serving as commander of Air Force healthcare facilities. Over the course of 11 years, he led 4 separate Air Force Reserve medical facilities. He was responsible for the leadership and management of all medical and allied health professionals, as well as administrators. Dr. Langell is well known for his work as a minimally invasive gastrointestinal and endocrine surgeon, tenured educator, developer of advanced medical education programs, and federally funded researcher. But he is equally known for his effective, appreciative, and inclusive style as a leader, his expertise as an innovator, an operator, and his forward-thinking approaches as a change agent and Lean Six Sigma black belt. With more than a dozen patent filings, Dr. Langell is a supporter of research, enterprise, development, and innovation. He received his Bachelor of Science degree at the University of California at Los Angeles. He received both his Doctor of Medicine and Doctor of Philosophy at Drexel University. Dr. Langell completed his surgical residency at Stanford University Medical Center and a residency in space and aerospace medicine at NASA University of Texas Medical Branch. During this period, he earned his Master's of Public Health degree at UTMB while researching pharmacological countermeasures for space radiation toxicity. He also has a Master of Business Administration, which he obtained in the Executive MBA program at the University of Utah. We're excited to have Dr. Langell here to moderate today's discussion, especially given his broad experience in healthcare, business, and the topic of crisis command, which will guide today's conversation. With that, I'll turn it over to you, Dr. Langell, to get this started.
Thank you, Steve. I'm excited to be here this morning to moderate this conversation. Welcome to everyone who is joining us. We have a lot to cover this morning, and I encourage all of you to interact using your chat function to submit questions, as I'm certain all of you will have them. And welcome to our distinguished panelists. This morning, we have Christine Young from Akron Children's Hospital, Dr. Lydia Cook from Summa Health, and Mr. Steve Abdenauer from Cleveland Clinic, Akron General. As Steve said in his introductions, this last year has certainly been unprecedented. As healthcare professionals and leaders, we have been tested in ways we never anticipated. So have business leaders, regardless of their industry of practice, as they faced many new challenges and have shifted the way that they operate. In healthcare and in the military, we are familiar with the concept of crisis command, which centers around our ability to make quick decisions during a moment of crisis. We train routinely to do so. The success in any crisis command situation relies on many functions, including delegation, trust, communication, process, and the ability to reflect and to pivot. Reflecting and pivoting, often known as the hot wash in both the military and in healthcare, is done to ensure we are doing what we need to do based on learnings that are occurring instantaneously. My 24 years as an Air Force officer have allowed me to both participate firsthand in crisis command and to observe how powerful this approach is for a well-prepared organization to handle contingency operations seamlessly. While today's leaders are all in the healthcare space, the lessons they will talk about today have broad applications to business as well. As we can all learn from a crisis to improve and restructure the way we approach leadership, challenges, operations, and the way we interact with those around us. During our conversations this morning, we'll draw from the lessons each of our panelists has learned over the last year and discuss ways these lessons can be applied to leaders and business professionals as we move forward. With that, we're going to get started. Thinking back 1 year and how quickly things changed for all of us, I would like each of the panelists to set the scene for the early days of the pandemic, the ways that they had to alter course in doing things. What was your biggest shift and what was your biggest challenge? I'm going to start with you, Dr. Cook.
Well, thank you, Dr. Langell. Good morning, everyone. It was 1 year ago that the World Health Organization declared the global pandemic. I was like, wow, a pandemic. I never thought that a pandemic would occur in my lifetime. And the weeks and months that ensued challenged and tested us. And we were concerned about our team, our coworkers, our family, and our friends. And we were concerned about their safety. It was funny because every time someone got a cold or respiratory symptoms, we were scared that was this COVID-19? And so lucky that we're in a health system that prepares and does emergency preparedness and disaster preparedness. And so as all of the health systems, and you'll hear from my peers here, we have a hospital incident command system that's activated right away. Dr. Devaney, who's our CEO, coordinated with the state and government and also coordinated with the other health systems. And we were made into different zones throughout the Ohio. We had our infectious disease expert, particularly Dr. File, who we're excited to have part of our organization, and he's a professional leader in our infectious disease society. We had our performance solutions individuals helping and supporting us to facilitate all of the leaders throughout the system to be able to coordinate and make the changes that we needed. And the major change was how to keep our hospital staff and physicians and advanced practice providers safe, and at the same time, how to deliver care to our patients. So I think the biggest shift we made was how to shift individuals and redeploy them to home. And we need our IT people to help us with that. Our next biggest change was how to conserve our PPE, because at that time we weren't sure, how this disease was transmitted, how contagious it was, and we wanted to make sure that we kept our hospital staff safe. And we didn't have a lot of PPE, so we depended on our supply chain leaders to work with us to do an inventory throughout. We early on in infectious disease, we had a video visit conference with some physicians from Shanghai to really understand how the treatment of the disease took place and what their experience was, so we could precipitate some changes in our care at the hospital. And then we quickly switched to virtual visits, and that was a key in order for our patients to be able to continue to access us and to keep them safe at home. We were able to have our IT people switch to a virtual visit platform. We also had a retail virtual platform that we utilized for free service to those in the community that experienced symptoms, respiratory symptoms, and they were concerned about whether they had COVID-19. And they were able to go on that platform for free and ask questions about and talk to our physicians and our advanced practice providers to help them and support them in the next step of whether they should seek care or how they took care of themselves. And early on, things were up in the air as to how to prevent and make sure we protected one another from the spread of the disease.
Thank you, Dr. Cook. Mr. Abdenauer, I'm going to ask you the same question. What was your biggest shift or your biggest challenge?
Okay. Thank you. I'm pleased to be here. I want to avoid repeating some of the things Dr. Cook just mentioned, because we followed some similar implementations. But I will say, if you recall back about a year ago, there's an incredible amount of, there's a great unknown out there. A year ago, we were seeing what was happening with the outbreak in Italy and then in Spain, and there's an incredible amount of fear of the unknown. So one thing I would add to what Dr. Cook mentioned was communication. I think that was the biggest thing that we saw that we had to shift and shift immediately for us. So there's, again, a big fear of the unknown. People are unsure at this point, like how susceptible they are to the disease. Anybody who's coughing, all of a sudden, what does that mean? So the way we handle communication here and in most hospitals, we set ourselves up in a series of daily huddles, and these huddles kind of cascade, and they start at the smallest level, at the grassroots level, where the work is being done at the unit base, and then they cascade upward from there. Now, recall at this time a year ago, you're being told, avoid gathering. So normally we have a large huddle that has our 40 or 50 leaders all in one room going over things, and all of a sudden that's got to stop. So it's a quick pivot to technology and how that can help us. So it's having people work from home, avoiding gatherings, but at the same time, how are we providing and convincing folks we're providing safe care in an environment where the information, and it's not an exaggeration to say it's changing daily, sometimes it is changing hourly as that information comes through. And that creates a great deal of frustration and uncertainty out there. So it's a matter of how do we increase our communication appropriately and in a safe way by leveraging technology, installing, Microsoft Teams, Zoom, and that means going out and purchasing a lot of additional portable electronic technology in the form of laptops, cameras, loading software and such. And then part of this is the fact that Cleveland Clinic Akron General, we are a member of a larger organization, the Cleveland Clinic. So even though we're one of the largest employers here in Akron, we represent only about 10% in the Northeast Ohio area of the Cleveland Clinic proper. So we're trying to get information to and from Cleveland, and we're trying to all take our cues from the CDC, who's the best repository of information at the time. So a lot of these changes occurred with communication channels upward and downward. And ultimately, these led to a lot of process changes and workflows.
Thank you, Steve. Ms. Young, we'd like to give you the opportunity to answer that same question. What was your biggest shift or your biggest challenge?
Thank you. Good morning, everyone. Again, in an effort to not be repetitive, I'll kind of echo everything that my colleagues have mentioned, but maybe I'll talk a little bit about how the hospital incident command structure changed us, because that's how we really pivoted at that moment. So way back in February, we were actually meeting on an informal basis as a leadership team with all of our key stakeholders and subject matter experts to start preparing. So we pulled out a lot of the work done around Ebola to see if there was any alignment, lessons learned that we could learn from that situation that we had dealt with, certainly on much lesser of a scale than what we were anticipating for COVID-19. But I think the hospital incident command structure provides an organizational structure that might not exactly be aligned with your administrative structure. So there are some different roles that people would take on. So as the operations section chief, I was responsible for some of the things that were in my administrative area, but not everything. So things like security and infrastructure were reporting up through my section, which were unfamiliar to me. And some of the things that I was used to overseeing went to somebody else, right? So all of those roles are defined and aligned. And I think the other thing that is one of the biggest shifts is that, we're used to doing things independently, making independent decisions, and we still did, but there's that connectivity at the incident command level for that awareness and alignment around meeting the objectives of the situation. So, the hospital incident command is really management by objectives. So you set your objectives, everybody is focused on those same objectives, and then you have the reporting structure up and down to make sure everyone is driving toward meeting the objectives of that period. So that, I think, was one of the biggest shifts for us, was trusting others to manage areas that you might have managed before. And I think that awareness and alignment of your leadership then really helps to align the rest of the workforce, because they need to understand too, what are those objectives, and you make them clear, you make them simple, and they may change over time. It was changing almost on an hourly basis. And I think the other thing that we were dealing with as healthcare providers, we're used to being the experts, right? We can step forward and take on anything, but there was so much unknown that there was a lot of fear and anxiety in the workforce. And that's really what prompted us to go into formal incident command on March 13th. I'll never forget it, Friday the 13th. And we got a call saying, people were starting to not want to come to work and not be clear. So that's when we decided we had to pull the formal team together and start to respond to this in a formal way. Not that we hadn't been doing preparation for months.
Thank you, Christine.
Oh.
So each of the panelists described a team-based approach, and one that was agile and allowed them to pivot on a moment's notice. Now, this is not easy to do if you're not prepared for it. So preparation is key. So Steve, infectious disease is not uncommon in hospitals, and we have systems in place to be prepared for those types of crises, just as each hospital is part of a national response network for mass casualties. Can you speak to the importance of having a plan in place? What are the most critical parts of this preparation to actually have in place? And what advice would you give businesses to ensure that they are best prepared for unseen circumstances?
Okay, thanks for the question. And actually, it's a good segue after Christine's answer to the previous question. So at Akron General and most hospitals, we follow a FEMA model for emergency preparedness. That's the Federal Emergency Management Agency. So, and we use that for internal and external disaster situations. And this is not something that would be peculiar only to hospitals, and it's encouraged for most industries. And it does involve an elaborate structure. And actually, if I can go the old-fashioned way and share my screen. So I'm not expecting anybody to read anything off of here, but if you can just kind of get a glimpse of this command structure org chart, it is kind of elaborate. And what I would suggest to folks is, no matter what business you run, pre-identify your resources for specific roles. So this emergency preparedness model that we follow and our colleagues follow with the other hospitals, it pre-identifies resources who can help you run and make decisions at the appropriate levels of operations, logistics, planning, infrastructure, security, business continuity, human resources, and finance. And once you have identified these resources, you drill, you do tabletop exercises, and you do them with different scenarios. Christine mentioned previously that what they drew upon was, when we had the Ebola scare a number of years ago, and even prior to that, when we had a bird flu scare, what could we draw on that to pull into this situation? But pandemic aside, other industries have to be concerned about what are potential business interruptions to you or your business. Severe weather is a big thing in our area, snow, ice storms that lead to power interruptions and whatnot, or supply chain interruptions, or human resources or labor issues due to some kind of sickness or an inability for people to get to work. So the suggestion is, no matter what business you're in, pre-plan to have people and resources available and have multiple resources for each of these areas in case one person is out or unavailable. And then the last thing I'd mention is use the term, Dr. Langell, about a hot wash. Take the opportunity once something happens and you have to deal with it to do an after action report out and determine what went well and what areas do you have for improvement, and then plan around those.
Would any of the other panelists like to discuss hot wash or how they implemented hot wash at your institutions?
I think that Steve has brought up a very important point. Business continuity. Every day in day-to-day hospital systems, there are things that really maybe fail you. Technology sometimes fails you. People are not able to come to work for various reasons, and the pandemic just really elevated that experience. And so I think that we are comfortable in really activating our incident command with small things that happen in our system. And so since we were used to that and people had those roles and responsibilities, it was quick to look at what worked, what didn't work, what should we do in the future? How do we modify our workflows and processes to remedy some of the things that didn't work well? What's happening in our technology space, and how do we need to upgrade or repair or patch or resolve so that we don't see this issue in the future as well? Because we depend on those tools and resources in our workforce in order to deliver care to the patients and the community. And if we don't prepare for any little thing that might interrupt our business operations, then we will fail our patients and their families in the community. So I think that it's key, and businesses in our community could really adapt to looking at that business continuity plan and putting those plans forward ahead of time and learning from past experience to say, what can we do different and better in order to make sure that we provide the service to our community, whether it be in the hospital systems or in any other business in our community.
I can add an example to that related to the hot wash. So what we found when we looked at allocation of resources, and that's the other thing about the incident command system, is that you want to look where your resources are needed and you can shift where they're needed. So after one of the hot washes that we conducted, we recognized that the medical branch of the structure needed more resources and needed to be elevated to a higher level in the structure. So in the beginning of the pandemic, the medical branch was reporting through the operations section. But then as we got further into it, we pulled the medical branch out and had that report out as its own entity versus being through the operations branch, just because there was so much going on in the medical branch. So many people needed to be involved about creating policies and protocols and responding to the medical needs of the patients. So that was one thing that was a result of the hot wash. And I think that's applicable to, any kind of industry, is where do you want to put your resources, where are they most needed in your structure?
Yeah, I'd like to comment on Christine's perspective, because I think that it's important that people know that we have to push things to the front line where they're handling it every day. And we have to trust that creativity and that innovation and that professionalism at the front line to know how to organize that healthcare delivery in these type of crises. So that's a very important point that Christine brought up.
I'd like to remind the audience to participate and ask your questions within the chat function. Certainly, the information that all of you have shared with us has focused on the fact that this is not an individual effort. This is a team-based effort, and team-based efforts require leadership. With the fast pace of changes that occur with crisis management and crisis command, the concept of leadership by consensus really doesn't work. You can't respond in time. And many of us have been taught that command and control is not the best way to lead most organizations. But you have to do things differently during a crisis. So I'm going to start with a question for Christine about prioritization. During a crisis, you quickly realize there are some things much more important that need to be accomplished than others. And quick decision-making is important in order to elevate critical work and accept that many of the things that have been your priorities in the past just aren't your priority now. Can you talk about the way you and those at Akron Children's prioritized work? How did you ensure that staff understood how their work fed into the bigger picture? And why is this important? What can be learned from this prioritization strategy that you used, and how can it be applied more broadly? I realize it's a mouthful, but please comment as you can.
Okay, I might ask for a reminder on one part, but I'll start with the prioritization part. I think in the beginning of the pandemic, we're always focused on safety first, right? And I think that's applicable to any industry, is you want to keep your customers, your workforce safe. And so in the beginning, we all know that we were dealing with significant PPE shortage, which would have impacted our ability to keep our team safe. So that was one thing, and that was a high priority for the workforce. They were very worried about their own safety. They were also very worried about their family's safety because they were coming to work and then going home. And because there was not a lot of testing, every patient had the potential to have COVID-19. So there was just this true unknown fear of their own safety. So that was one of the priorities. And I think that was one that rang true with our workforce. And that's how you align everyone to the line of sight. Our first objective in our incident command was to keep our patients, families, and staff safe. That was the priority one. And then going through making sure we have enough resources, whether they're human resources or capital resources or operational resources, supply resources, that was, contingent on keeping people safe. So one thing that we did that I think was very effective in connecting. And so we want to connect the employees to the mission, but we also want to make sure the employees understand we're connected to them. So I see it as bi-directional. So our hospital leadership team did videos every single day after our incident command meetings were done to do a report out of what was happening and what the priorities were. And those were very, very effective. So in the beginning, our incident command team was meeting twice a day, 7 days a week. I mean, they saw us, the workforce saw us on the weekends, being present, doing those videos. So I think it lent itself to, we're watching this, we're aware, we're making sure that we're adapting to changes as quickly as we can. So I think incorporating that is really important to make sure that the workforce know that they are contributing to the objectives by making those objectives very, very clear and simple. I mean, they were not complicated. They were the clear objectives that we had to achieve. One of the other ones was preparing for adult patients. And we're a pediatric institution where we take care of some adults, but not on a regular basis in some of the areas that we were going to need to. So providing those resources early on to make sure that the teams felt ready to do that, whether providers, nursing, all those different jobs needed to be prepared, and we needed to be able to prepare them because we wanted to make sure that they understood our mission was now bigger than just the patients coming to Akron Children's. Our mission was caring for the patients of our community and our region and really, across the nation as we help to respond to the pandemic. And so I think that is, applicable to any industry when you want to share your objectives clearly, make them simple, and then get feedback from the workforce about their concerns about it. So we also had an email set up where any employee could send a concern, coronavirus.org, and they were able to get those answered quickly. And we had people manning those and making sure to close that loop of communication to make sure that they understood that they were a critical part of achieving the goals. We couldn't do it at just the leadership level. It had to be across the entire organization.
Very related to your response, we have a question from the audience. What lessons in organizational resiliency, both people and tasks, have you encountered? Normally, as leaders, our job is to take care of our people and return things to normal as soon as we possibly can, while remaining mission focused. Topics such as self-care have taken on new meaning during the crisis because we could not return things to normal, and we are unsure of exactly what the new normal will look like. Steve, can you respond to that question?
I guess if the crux of the question is like, how are we considering care for our employees and such, and making sure we're mindful of their well-being. First of all, we refer to all of our employees as caregivers, whether you're stocking the shelves, or you're a heart surgeon, or you're sweeping the floor, or you're checking the doors in security at night, you're a caregiver. And we have what we call an Office of Caregiver Experience. And the sole purpose of that group, and this is one of the benefits of being part of a larger enterprise, is having some resources that you can go to. Thinking about like, how do we continue to ensure the safety and the well-being of our staff? And that led to things like, piggybacking maybe on what Christine was talking about, if you had caregivers who are dealing on the front line directly, hands-on with COVID positive patients, and they have a concern that I think I'm using my PPE correctly, but have I been exposed to someone who is maybe asymptomatic at this point? And now am I in danger of taking this home to my family? Or is someone at home sick? And how do I then, what's the protocol for coming to work? So our Office of Caregiver Experience set up some conditions whereby, and I know the city of Akron did this as well, potential accommodations for caregivers in town if they wanted to quarantine from their families but still perform their job duties. Similarly, we set up for caregivers who became positive. There were daily follow-up calls to them at their homes, checking on how they were doing, and we even offered meal services to bring them to those employees at home. Again, just to let them know, listen, we are all in this together. You are all part of the team. We want you healthy. We want you safe. We want your family safe. We want you to come back to work, but all under the guise of being done as safely as possible. And I hope that got to the crux of the question.
I think it did. And I'm going to elaborate on that question a little bit more for a response from Dr. Cook. When we talk about resiliency, it's that ability to flex so that we're not breaking the system. And I think many health systems struggled with the burnout that was occurring and the concern for self and for family. Am I going to bring this virus home and be responsible for the death or the morbidity of a family member? Can you talk a little bit about what you do did at Summa Health to address resiliency for your employees?
Yeah, I think that it was very important, and I'll just carry on from Steve's perspective to really acknowledge that this was something that we've never experienced before, and the kind of emotions that were charged during the time, the fear and the concern about your own well-being, as well as making sure that you take care of your patients. And at that time, family members couldn't be in the hospital because of the risk of contagion. And so people were left alone to really be comforted by our staff. And as Steve said, caregivers are everyone and anyone who does something to support the care of the patient, and everybody is valuable in that support of the care. So our healthcare heroes, and I think all of our health systems did that, campaign was really significantly important. And I think the community played a great role in contributing and sending kind thoughts, children creating beautiful cards to our healthcare heroes, donations so that we could purchase meals and food, allowing people to, as Steve talked about, stay from their family, but then still be able to FaceTime or communicate with their family, allowing our employees to be redeployed to home. They had people, everybody is people, even though we're trying to take care of sick patients. We also have a home situation where our kids are home from school. Our family members are maybe getting sick as well. So there was a lot of disruption at that time. And so we really wanted to make sure that our healthcare heroes were taken care of. And I think that community played a role. Also, we deployed our mental health. We have a strong behavioral health department, and they are always focused on mindfulness, the self-care. And we also let people know, be vulnerable, don't worry, access this behavioral health services, because we know that there are challenges here at work and at home. And I think that that is really important to just show that passion and care because of the emotionally charged situation and the illness and the death and dying that we were facing.
I can add just one comment too. I think when we talk about crisis leadership, it doesn't end when the crisis ends. So we're all looking forward to when we're calling this over. But I think there is going to be a need for a lot of leadership, especially in this area of resiliency and recovery for the workforce post-pandemic. So it's not something that we're going to be able to say, oh, we're done. I think there's going to be big implications as everyone starts to try to return to normal, and what kind of things, what kind of post-trauma manifestations we're going to see in the workforce. And so that part of this will not stop. That will have to continue to maintain the health of the workforce moving forward. And we just don't know how long that's going to last.
I'd like to bounce back quickly to a topic we covered a moment ago. And I'm going to ask that Christine answer this because I thought she did a great job talking about the topic. Question from the audience: how do you structure a hot wash so it doesn't feel like Monday morning quarterbacking? Or is that the point?
That's a great question. So how we did it, and you can do it in a little bit different ways. We had people think about it. So we didn't just get all in a room and start throwing things out, because that's, I think, where you can go a little off center. So we asked everyone who was involved to actually complete a document where you identify the 3 biggest strengths and the 3 biggest areas of opportunity and what we could improve. And then you compile all that together and then start the conversation off of those themes, starting with the strengths first, because it's unfortunately limited to 3, because you'll have 100 strengths and maybe 10 opportunities, but everybody's going to focus on the 10 opportunities, which you should to improve your performance moving forward. But it was really done as a group, as a team. This was the team's responsibility. The hot wash was about the team and our operations, not necessarily about individuals. And I think bringing those, having some time to think about it, bringing them forward as themes, and then having some discussion helps to minimize that.
Thank you. We've talked a lot. Oh, somebody had another response.
I was just going to add on to that. We similarly conduct hot wash in the same way. Participation is looked upon as being mandatory, representing your area. And again, we kind of approach them in the same way we would approach what we call a root cause analysis. If there's been a failure of some kind, the intent is not to assign blame, but it's rather to let's look at all the circumstances that led to a situation where we know as a group or even as individuals, things could have been done better. And then what do we do to mitigate that going forward?
Yeah, I just want to emphasize that the judgment and blame, this is a blame-free environment where we're looking how to improve workflow and processes. And we have an I'm for safety culture, and we want you to speak up and really bring forward your perspective around what was working, what's not working, so that we can really make a difference and make things better. So yes.
Going through the process of crisis command, we've talked about the importance of prioritization and of leadership in this team-based approach to a really rapidly changing environment. And each of you addressed how a hot wash has been important for understanding things in real time and pivoting quickly to be able to be successful. But ultimately, it's your success factors that let you know whether you were able to respond appropriately. And as we reflect on this past year, one of the things we need to look at was where were we successful and where were we not successful, and how can critical successes be applied to business? So Dr. Cook, being nimble is really important. During our conversation, you talked about the importance of remaining nimble. You had to change things overnight from where and how people worked to the way you served patients via virtual visits. How did you foster this ability to be nimble before you had to employ it during the crisis? And how can businesses strengthen this muscle day to day?
Yeah, I think that to really cultivate that nimble approach stems from organizational trust. And we say we are a team not because we work together, but we are a team because we respect, we trust, and we care for one another. And I think that that kind of mindset and the collegiality and the family culture that we have here allows us to quickly pivot when there is something in front of us that we have to manage. And so our physicians, our staff, all are in a governance structure that really kind of fosters that quick change from one platform to another to really care for patients. And if we keep that, we usually say, keep the patient and the family in the center of what we do, and then all of it will work out in the end. And so I think that with that approach and that trust in one another, we said, hey, we can't see our patients face to face because there's a contagion out here, and we want to keep people safe, and we want to keep them free of this virus. So we still have to care for patients because we don't want them to delay their care and be sicker, because at that time we were seeing much sicker patients, not due to COVID, but to other disease processes because they weren't accessing care. So our quick move to virtual was the way that we would approach that. We also looked at, and SUMA has long been in advancing health equity. We have a SUMA Health Equity Center. We also looked at the most vulnerable populations, people that had difficulty accessing care even before the crisis happened. That made it even worse during the crisis. And we put together a virtual platform with our community health workers to do what we call the reclamation project and reach out to those individuals that hadn't accessed care in a while and that we felt wouldn't be able to access care. We also looked at the digital divide, and we had businesses in our community, in the greater Akron community, that contributed and helped us to get grants so that we could help our families to be able to have broadband or access to the technology that they needed in order to really meet with their physicians and their care providers. Those are all really important, because if people can't access the care and we delay care during this crisis, then we're going to really be dealing with a much sicker population. It was also important to continue to provide preventative care and our screenings. We also work with the Summit County Public Health Department to say, how do we test the most vulnerable communities? And we put together a mass testing event. So it was a lot going on during that time that we had to really look at. And I think because we trusted and respected one another, and our physician leaders are really out there being creative and innovative all the time, it was just a natural next step to really move into the virtual platform and thinking about how to care for patients in that different way. And actually, it was good because I think healthcare was always behind in that leveraging of that virtual platform and that technology. And the consumers really have embraced that interaction on the platform. Even our elderly and senior population, surprisingly enough, have enjoyed the interaction with the virtual visit.
Thank you, Dr. Cook. Steve, one of the key success factors that we've talked about was teamsmanship. And building a high-performing team is much easier said than done. It relies on collaboration. And we talked about the importance of command and control during crisis management. And that's a delicate balance. The pandemic created a universal crisis for healthcare providers and institutions. You all found yourself in similar situations and formed an unusual collaborative unit. Can you talk about the role that collaboration played in your success, and what advice would you give to companies who may be weary about pulling in help or working with their peers, competitors relative to the impact it can have on their total business?
So I guess what I'd say is in a crisis situation, you know what, you're all in this together. I think that's the way we look at it. Now, normally from our perspective in hospitals, you know, we tend to communicate at more of a casual level. You know, we'll cooperate, you know, on events and circumstances that benefit the community. We discuss like special needs situations. There are specific areas that we all collaborate on. Some of us have specific ventures that we work together on. And we even work together when there's an impact, when one of us has an impact. And let's say we're short on supply. It's not uncommon that we'll go to one of our friendly competitors. We'll reach out to Children's or SUMA and say, you know what, our sterilizer's down. Can we bring some instruments over and have you guys help sterilize them for us? Or can we borrow specific supplies if we're short? So we've always had that going on in the background, but this was clearly different. This is something that impacted all of us. But more importantly, I mean, it was I think we all felt that the community and all organizations would be better served if we worked together for cooperation. So we're all a member of what we call ARHA, the Akron Regional Hospital Association, which has routine meetings. And what we did was we really leveraged that relationship to the point where we're having weekly and even daily, and at the height of the pandemic, multiple times a day, conversations with subgroups on those teams. And this is involving not only the hospitals, but it's also involving Summit County Health Department, Donna Skoda and her team, the city of Akron. We're pulling in the post-acute care network. So these are all the nursing homes and the folks where sometimes we will send patients after their discharge, but they're not ready to go home. So pulling them all in together and forming a specific task force where we're sharing information daily, multiple times a day sometimes, discussing capacity. Because if you recall, this outbreak was not something, at first, we were seeing pockets of this. So Canton might have an outbreak, but everybody else was okay, or it might move to Youngstown or Medina or Akron. So we set up teamwork and to discuss capacity, set up a transfer hub with a hotline where we're all talking together about who is in need at this point. Where are the hotspots arising? How can we help? Can we transfer patients between organizations or send them to the area that has some capacity or bandwidth? And then even at a greater level, we were coordinating, regionally with Cleveland, and the state even recognizing the governor that he had too many regions to actually address this appropriately. So they combined the Cleveland region and our region together. So there was a ton of cooperation, and I will tell you, I think we were all the better for it. And I would like to believe that going forward, we will have more ongoing relationships in these areas that we probably didn't have before.
We've got two additional questions from the audience that I want to make sure we get to. The first one is specifically asked of Christine. This crisis has altered the way much is done in the short term. We've talked about the long-term impact of virtual visits. Let's talk about internal trends that will last. Christine, can you speak to the importance of cross-training, how it took place, the impact that this had, and why you think it's important to continue post-COVID-19 as a best practice? Is this something you think can be a general business practice as well for non-healthcare leaders?
Sure, thank you. So our examples of cross-training really involved getting our teams ready to care for adults, as well as a shift in the care delivery model if we were to get intensive care patients. So, we have models set up of how we care for patients historically. They have a nurse assigned, they have a provider team assigned, and we were going to have to shift that if there were a couple things that would have happened. One, a surge of patients, a surge of intensive care patients, or a surge of adult patients. So we had to make sure all those teams were cross-trained to manage all those areas, and look at the model of, one person's the leader and shifting to that team approach. I mean, we've been talking about the team approach. So not only at the leadership level, but also at the care delivery level, we had to think differently because of the skill sets of the current people that we had, and there were no more people to obtain, right? There were no additional resources. So we had to work with what we had. So I think that is certainly applicable in any kind of crisis situation where you have a human resource impact. The more flexibility you build into your workforce, the better. And I definitely see that moving forward, especially in pediatrics. We have a very seasonal trend of when we have high volumes in the wintertime. I mean, not right now because of all the measures in place, but if things go back to the way that we've seen them historically, and they may or may not, but managing through those surge times, and that's applicable to any healthcare organization, surges in your emergency department, surges in your intensive care unit, or surges in industry where you're not expecting something. I'm sure that the supply chain teams were, having to respond to this the same way that we were because of the need for increased PPE and other resources that were needed from the supply chain perspective. So I definitely think that looking at delivery models differently will be something that's sustained post-pandemic and post the crisis period of this pandemic. Cross-training people to virtual platforms like Dr. Cook was talking about, I mean, that's been a huge shift, something that I would imagine will sustain, into the future, that we'll have that virtual platform. We had been building it, albeit it was rather slow. And this caused us to have to really put, full steam ahead, accelerate and get it done. So we actually did way more in a short period of time than we would have ever even anticipated ourselves being able to do. But I see that in, the pediatric consumers, their families are very much interested in maintaining that virtual platform as well. And just how we manage our teams. Are they virtual? Are they in person? So thinking about the way we do things moving forward. I think that was what I was talking about with cross-training.
Very good. Thank you for that answer. I do want to jump back for a moment. I believe Steve had talked about collaboration that was taking place across the hospital systems as a network. This was something probably not done, at least to this level, ever before, or perhaps at least not for the last century. Will you continue to have a different and more collaborative relationship with those that you normally would consider competitors once COVID-19 abates, or do you think you're going to return to business as usual between the different systems? Start with Dr. Cook.
Yeah, I think that Steve really touched on it perfectly. And we at SUMA, along with Akron General, along with Akron Children's, we work together on initiatives that impact our community as a whole. Infant mortality comes to mind. We do coordinate and really work on how to improve our infant mortality rate. The other thing that we work with Akron Children specifically on is transferring complex care patients as they, transition into adulthood. I think that we also work together with our legislatures in really specifically talking about virtual visits. How do we get to ensure that payers and the government reimburse for those virtual visits, audio and video, at the same rate of the face-to-face. And I think we coordinate together on that in terms of legislation. Our approach to talking about when Christine was highlighting cross-training, we are short-staffed. And I think we're working on a legislation to allow people to work cross state licensures so that we can then have people come in and support us in these types of crises. So I think we worked well together before, and I don't see us not working well in the future. I think whatever really advances the health of the community, I think that that's the approach we take. And I would encourage businesses at large to coordinate and work together, especially for business continuity, and to really kind of learn best practices and share best practices. And I think the hospital health systems do that well, sharing those best practices and really deploying and the learnings from those best practices.
Dr. Cook, I think that was an excellent answer and exactly the type of answer our patients and our communities want to hear from us in the health system. So thank you for that. We're running a little bit short on time, and I do want to get to a couple of more important questions. And this one's going to be given to each of you. And I'm going to start with Steve. Regarding personal learnings, what did you learn about yourself through this experience during the pandemic that will change the way you approach situations or how you will work moving forward in a different manner than you have in the past?
All right, I think the quick catchphrase answer to that for me is be adaptable, remain adaptable. And it's a realization of several learnings, a realization of the importance of communication at all levels. And again, especially when you're dealing with, an uncertain situation, that can translate into a fear factor for people that you're working with. And that's all people. That's your employees, your caregivers, that's our patients and visitors, their family members, it's your customers. And I think another learning is, people are more forgiving and they're more tolerant when they're informed. And that goes for staff, patients, visitors, and your customers. I think people will understand a difficult situation, tell them how they're going to be impacted, and tell them how you're ultimately still plan to meet your needs, how you plan to meet their needs. And I do believe they're forgiving in that regard. And then lastly, I guess I talk about or pirate off of Winston Churchill, who said, never waste a good crisis. And I don't mean to be flip about this, but this was a tremendous opportunity for us to stretch people in different ways. There were so many task forces we created out of this to deal with just a myriad of different issues that we had to turn people loose, delegate folks, and tap people on the shoulder who maybe had never had the opportunity to move into a leadership role at any level. And you know what? It's just empowering and it's emboldening when you see people succeed, because it can tend to bring out the best in some people. And I think that's just a wonderful lesson we can see out of this.
Christine, I'm going to ask you that same question. What were your key personal learnings from operations during the pandemic?
Or so to piggyback a little bit off of what Steve said, I think he's right on when he said looking for other leaders. And I think that's one thing that I've learned. There are hidden leaders throughout this organization who have extreme potential to do amazing things, and we need to tap into them. And typically what we found is they're at the front line, and they're providing that care, and we need to give them the opportunities and bring them along with us and trust them in their decision making. One of the other things that I think as a personal learning, I really learned how to make decisions more quickly. I tend to want to see data and analysis, do an analysis, and be very thoughtful and create a perfect deliverable. It was not possible to create perfect deliverables. We had to go through cycles, and we used our PDSA cycle as our kind of mantra. We're gonna try this, and if it doesn't work, we're gonna try something else. And that was not indicative of failure as a leader. That was actually seen as success as a leader, that we were trying different things to achieve that objective. So I think, there are certainly times where you need that thoughtful, long thought out process, but then there are other times when you need to just say, let's continue to try some of these small changes and see what impact we can have. And so that's really a lesson I hope to carry forward in my leadership style moving forward, because it was a little bit out of my comfort zone, to be transparent.
And Dr. Cook, your personal lessons that you will carry forward in your operational activities.
Yeah, I tend to be a driver. Let's do it, move, quick. And I have really talked to my team, and I say, let's step back. Self-care is important. If we don't take care of ourselves, we can't do our job, and we can't take care of others. And I've really learned to really embrace that self-care. I think that's really important. I think the other thing is meeting people where they're at. There are circumstances and situations in people's lives that we don't know. We've discovered so much of it during this pandemic. And we have to really meet people where they're at. And when you're a driver like me, you have to step back, bring that awareness to the top of your mind and say, wait, this individual is not ready to do this. They can't do this. Let's think of what else that they could do that would feel comfortable for them. And so those kinds of things are the learnings that I took place. Because of that driver in me, I have to really step back, self-care, meeting people where they're at, and showing that compassion and kindness and understanding.
I think we have time for one last question that I would like all of you to answer. And I'm going to start with you, Steve. What advice would you give to business leaders after having this experience relative to the one thing they can do to strengthen their operations and practices to be prepared for anything?
Okay, I would go back to what a number of us were talking about earlier in our more formal emergency preparedness situations. Again, identifying who your resource and your go-to people are going to be. Things were a little different in this situation because at least we could see this event coming. I mean, it was moving across the world, and it was starting in Oregon and then moving, towards us. So we had at least a luxury, even though we didn't understand it all, we had a luxury of knowing things were coming. In most situations, when you have an emergency or a crisis situation, you don't have that kind of time to react. So if I could stress one thing, it's have your resource charts thought out in advance. Go over this with your people about what the expectations are, who's going to sit in the big chair if something happens at 2 a.m. on a Sunday morning, and who's going to make decisions from that point forward until you can get your structure in place and to keep the operation running in the near term. That would be my strongest advocacy for anyone listening to this, regardless of whatever business you're in.
Christine, I'm going to have you address that same question to the talented business leaders who are on this call. So I will repeat the question. What advice would you give to business leaders after having this experience relative to the one thing they can do to strengthen their operations and practices to be prepared for anything?
It goes along with what Steve was saying. I think preparation and thinking about what are your greatest threats to your business and actually running through either a tabletop exercise and thinking about where your resources are and what you would do if. And so that's what I think allowed us to stand these HICS structures up so quickly, is that we have trained people who who know the system, they know the processes. We also have some redundancy built into the system. So I have been incident command. I've been in that role before in other drills and other situations. So I could have done that role should our incident commander not have been able to fulfill that. So you have to build some redundancy and trust in that structure, because it's not always going to be your top leader who is going to be able to function in the incident command role, especially in a situation like this where it's been going on for a year. I mean, you couldn't ask people to not take a break at this point. So building some redundancy, making sure people are educated and trained on the process, and then thinking through what would we do if, and actually putting that out on paper, like having that discussion. So then you've already got some mental models built. So if you would have to stand something up, you could apply that mental model to the situation that you're dealing with.
And Dr. Cook, I'm going to offer you the last word to business leaders on the call today on the one thing that you think they should focus on to strengthen their operations and practices to be prepared for anything.
Empower your workforce, empower your people, let them be creative and innovative, and continuously improve them and set those roles and responsibilities.
And thank you for that final word. I want to thank our incredibly distinguished and talented panelists for their opinions and thoughts about the impact of the pandemic and how they stood up crisis operations for commanding their organizations for the benefit of our patients, and for the lessons learned that can be applied broadly to our business community. As we wrap up the morning, this virtual participation is going to be coming to an end very, very shortly. I think it's critical that we create opportunities for business and community leaders to come together to dissect these lessons and to learn from one another so that we can continue to improve the way we work. The stronger we are as leaders, and the stronger our businesses are, the stronger the region will be and our communities will be. I'm honored to have the opportunity to moderate this morning, and I appreciate the Chamber facilitating this important conversation. And with that, I'll turn it back over to you, Steve, for some additional closing remarks.
Thank you, John. Thank you, Christine, Lydia, and Steve, for sharing your insights this morning. And thanks to you as well, John, for your work moderating the conversation and wrangling all these smart people on these topics. You know, I think one of the last comments you made in terms of how we think about hot washing this experience for the community overall, how did we do a better job during this period of communicating, connecting with each other, helping our small businesses, ensuring people had the resources and the things that they needed? I think we learned a lot, and we did a lot that we maybe didn't even know we were capable of over the last year or so. So I appreciate that concept, and especially walking with this idea of a hot wash. How can our businesses benefit from doing a little bit of introspection about what they did well and what they could be doing better. So again, thanks to all of you for your expertise and your ideas and for sharing your experience so candidly with us. Our next leadership dialogue is coming up on March 23rd. We're going to feature a conversation between Dana Brownlee, President of Professionalism Matters and Senior Contributor for Forbes Careers, and Dr. Cliff Devaney, President and CEO of Summa Health, as they talk about fostering an anti-racist workplace. I'd also like to draw your attention to an upcoming Women's Network Leadership Institute offering we have launching later this month called Authentic Leadership, Leading with Strength. This 6-part series launches on March 16th. It's moderated by Dr. Jennifer Savitsky, Chair of the Department of Obstetrics and Gynecology at Cleveland Clinic Akron General. The series is designed for high-performing, high-potential women who are interested in learning more about ways to leverage their personal strengths and apply them to areas like collaborative leadership and management. So there's more information about that on our website, but check those out. I think it's a great opportunity for the leaders in your organization to connect with other leaders and also to sort of build their skills and their abilities for your organizations. Thanks to all of you for joining us this morning. We hope you enjoyed the conversation, and we look forward to seeing you at our next dialogue. Have a great day.